So here at Adler Advanced Dentistry, we have two different types of Invisalign that we use. We use Invisalign Express and Invisalign Full. Invisalign Express means that you get 10 aligners to make all the movement that you need to make. So that's really great for somebody who has minor teeth crowding, somebody that we're not really trying to change a bite on, they just want to move a few teeth maybe. The other option is Invisalign Full. That means you get unlimited aligners to make as much movement as you need to. That can range anywhere from 6 months to a year to 2 years, depending on the severity of what we're trying to change. Talia is our hygienist, and she is currently in Invisalign. And so she's a great model for us. Look at that, look at those chompers. For this video today, I just want to talk a little bit about why we use Invisalign and what Invisalign can do for your teeth and for your smile. So many of you know that Invisalign is what we call clear braces. And this, if you can zoom in here, is a little bit about what they look like. This is just a model of teeth, and these are the trays. And you know, to be honest, I don't love these trays because they're a little bit more clear than the actual Invisaligns. And actually, Talia, if you don't mind taking yours out, just kind of to show us, this is helpful because you can see how easily she can take those out. She's been in these aligners now for how long, Talia?
2 weeks.
2 weeks. So they're kind of loose and she can pop them in and out easily by using both thumbs underneath. So Invisalign you may think is just to straighten teeth, but there are other indications for Invisalign as well. Many people that we see come in to use Invisalign just for straightening, to make teeth pretty, and that's a really nice way to go. Sometimes it can only take up to 5 or 6 months. Now with Talia, for instance, her bite was off, and we used Invisalign to correct her bite. She's almost finished now. How long have you been in them total, Talia?
As of right now, I've been in for 10 months.
So 10 months, and she's already got what we call a nice, we call it a class 1 bite. Before she had an underbite, so her lower teeth sat behind her upper teeth, kind of like this. Can we zoom in a little bit there? So they were like this. So what we've done is we've used Invisalign to bump the front teeth out, and go ahead and bite down now, Talia, so that they cover the bottom teeth in a normal biting position. So Talia is going to show us how she takes the Invisalign trays out and puts them back in. So Talia is going to show us on the top. She just puts her fingers back on the top and pulls straight down and takes them out, and then you just do the bottom one. And the saliva is something that you get used to and learn to control. So you may notice, if you look really closely, at the little bumps on her teeth. Those are what we call attachments. And the attachments are there to help torque and turn teeth in certain directions. They're also there for retention, so to keep these trays locked in place in her mouth. So you can see they're tooth colored, they're not noticeable, and when you put the trays on, they're even less noticeable. So she's going to put those back in. She pushes down with her fingers, not biting them in, she's just pushing them in nice and tight. And then once she gets them in, she likes to look in the mirror, especially the first time after 2 weeks when she puts them in, to make sure that the attachments are engaging in the tray or in the aligner. So we want to make sure the plastic is completely covering up those little buttons. And Talia, as everyone who's in Invisalign, is wearing these aligners 24 hours. She's only taking them out to eat and drink and to brush them. So let's talk about how to take care of these. One of the most important things to know is that dogs love them. I cannot tell you how many times these have gone to a dog's mouth. They smell like you and they're like a chew toy and they will find them. So be very, very careful about where you place your trays. Another thing that's very common is that people will take them out of their mouths at a restaurant and put them in a napkin. And the waitress or waiter will come by and sweep them away, and now they're dumpster diving. So always keep them in your case when they're not in your mouth. After you're finished eating, they go right back in. It's really important that you wear them the time that's suggested, or they simply don't work. And sometimes you'll hear people who have stories of Invisalign didn't work for me, and a lot of times that's because they're not wearing them 24/7 like they should be. So as far as cleaning them goes, what you want to do is you take them out at nighttime, and then I tell people to use a dedicated toothbrush for some liquid hand soap. So instead of toothpaste, liquid hand soap is a great option. If it's antibacterial, that's even better. But you don't want your toothbrush to taste like soap, so I say designate a separate toothbrush for this. And the reason we don't like toothpaste is that it does scratch the trays, especially if it's slightly abrasive, and then your trays will pick up stain easier. So a little liquid hand soap, you brush the inside of the trays and the outside. If you find it difficult to brush the outside, you can put the tray in your mouth and use your toothbrush to brush it inside your mouth. Of course, then you're going to use toothpaste and not soap. So once it's brushed and your teeth are brushed and flossed, the Invisalign aligners go right back in.